Hello and welcome. It's another edition of the Touch a Cell show. Your sincerely, Toyin is with you again, and with me, as usual, is Maureen Wachi. Hello, Maureen.
Hi everyone. We're back again.
Yeah, welcome everybody. If you're watching us on Facebook, share this link, invite people because we're going to be talking about blood. And I know some people are going, blood, but it's very important, especially for us living with sickle cell. So share the link. If you're on YouTube watching, share the link and invite people as we will be talking about blood transfusion and all things pertaining to blood and sickle cell. And we have two very important guests that are going to be able to break down this information for us to be able to understand its importance. So, Maureen, I will bring on our first guest, and I will be the bio with our on her, and then we will bring on the second guest. Hi, with us we have Dr. Shade Kokola, and she is a consultant clinical hematologist with a passion for helping sickle cell warriors live their best quality life. She was trained in the Lagos University Teaching Hospital and St. James University Teaching Hospital, Leeds, UK, and she's a certified clinical hematologist trained in all blood disorders, and she's also mainly the medical director, Next Hematology Medicare, a world-class medical center in Surulere, Lagos, Nigeria, with a focus on apheresis, which includes automated exchange blood transfusion for sickle cell and a vision towards bone marrow and stem cell transplant. Services that are included in this facility include comprehensive laboratory, theater, and consultations with other specialists. So we welcome Dr. Bola Shade Pokuola to the Touch a Cell show. Welcome.
Yeah, you're welcome. Thank you very much.
Yeah, good to have you. While we're waiting for our other
How are you?
we're fine. We're doing great. It's been a cool day, thankfully. Started off as a hot day, then cool day, and it's just okay. Yeah. So we're waiting for our other guest. I think she has network issues, but while we're doing that, first of all, I'd like to ask you, Dr. Pokuala, on the basis of blood, what is the basic element of blood that is important for any human being, broken down into informative, educative sections, because then we always talk about blood. I know when you have an accident and you're losing blood, they always scream blood transfusion and all that. Okay, I said, what are the basic elements or what are the compositions of blood that is so important for any human being? Why is it important? Did you hear me? You seem to be mute. Yeah. Okay.
Okay.
Go ahead.
All right. Thanks for having me. So, yes, I did.
Okay.
The elements of blood within each individual are basically four different parts. Three of them are cells, and the other is the water that bathes the cells. So cells are actually more of tissue. They need a medium to move in, and that's why the liquid medium, mixes with it. When the different parts of blood are actually separated, you'll be surprised that it's only the red cells that have the color red. Every other
Mm,
thing has different colors. But the color red tends to, shadow everything within the blood. So the components of blood are cells and plasma. And the cells within blood are mainly three types of cells. We have the red cells, the white cells, and platelets.
Mm.
The red cells are the ones that carry oxygen. They carry oxygen to all our organs to provide nutrients to all the organs. So that's like the vehicle through which everything is transported, basically.
mm,
So but especially oxygen and nutrients. So when you have this in low supply, you'll feel very low energy, you feel tired, you might start having headaches, dizziness, palpitations, chest pains, and things like that. The second type of cell is the white cell. The white cell, these are the soldiers of the body. They're the ones that fight infection. So those are our white cells. There are different types of white cells, but we won't go into that now. The third type of cell is the platelets. The platelet is the one that prevents us from bleeding. So that's the one that keeps all the other cells within
Mm.
the blood vessels and prevents us from bleeding abnormally. If you've ever had a cut, or had a scratch or an injury, the cell that prevents you from bleeding out and keeps the blood working and causes the blood to clot are the platelets. And the fourth element is the plasma, which is the water that we all swim in and carries these cells to all the different parts of the body.
mm. Very, very technical, the human body. No wonder I always feel the biology. Yeah.
I'm surprised to hear that there are different types of white cells, but I
Oh,
think
yes.
we'll come back. Yes. So let me introduce Dr. Dr. Boduri Oshikomaya. Dr. Boduri Oshikomaya, she's a consultant hematologist and blood transfusion specialist, and she's also the executive secretary blood transfusion service. So it's good to have you. You're welcome to the show, Doctor.
Thank you very much. I am coming up in two places. I'm actually happy to be here to talk about this with everybody. It's good to see you there, Dr. Popola, my humble and very, very hardworking colleague. It's good to have you here. It's good to have the two of you here, Maureen and Toyin Adishola. Thanks for having me here.
You're welcome. Yeah.
Welcome.
Okay, so we were talking to Dr. Pokola about, and she was explaining the basics of blood. Now, from your own point of view, because she talked about blood in general, why is blood so important in the case of a person living with sickle cell?
Well, first of all, I must say that it's not just everybody living with sickle cell that needs to have blood. Blood is life. Blood is what transports oxygen, which we need to actually nourish all our body cells. It also carries a lot of other things, our proteins, um, inside blood. As she has said, we have so many constituents in blood. It also helps us to fight other infections, fight illnesses. So we need blood for so many things. Without blood, we all can't be alive. So irrespective of what status that you are, blood is actually very important. And for someone with sickle cell disease, having blood at the right amount is also important. Having the healthy type of blood too is important, because once all the bloods are sickled, as in if the red cells are sickled, you need blood. There's blood there, but you need the right type of blood to keep you out of pain and out of all forms of illnesses. So blood is important for everybody, and it's important for everybody with sickle cell disease. So the right amount matters, the type of blood, LD, and that is why when we request that any individual with sickle cell have blood, we also request for the best type, that's the hemoglobin A forms that does not sickle.
Okay.
Yeah.
Maureen, have you
People with the hemoglobin A. Yes. Does that mean that people with the hemoglobin AS, there's a little bit of sickling in their blood?
Well, it might happen. I have seen people with hemoglobin A with various percentage of sickled cells in them. Some might not have any sickle cells. So some people with hemoglobin AS, they act like people with SS when they are under a lot of stress. So in LD normal times, when there is no stress, when there is no illnesses, you might not find any form of sickle cells in them. There are some, when they go through stress and they come down with illnesses, by the time we check the film, we find some degree of sickle cells in them. But usually, for most people with AS, the degree of sickle cells is not enough to affect them and cause crisis. So there's a small percentage that have sickle crisis-like symptoms when they are under stress. Just a very small percentage.
Wow.
That's
Wow.
really
This is
interesting what you said.
exactly very interesting to know. Wow. So all these gist where sometimes that people who have genotype AS to some people have crisis or something like that. I don't know. It used to sound weird, but I think I'm beginning to understand it much better now.
Exactly.
Okay, so speaking of, yeah. No, Auntie Toyin, you can go on.
Okay, I was about to say that because I know in America there's this movement called the traits, where they focus on people, African Americans who are AS and have died because most of them were under sports stress, like football regimen. You know how or army, they went through a lot of rigors in their coaching, and some of the coaching was so extreme that it caused them to slump and die. And they found out that they had this issue with the thing like sickle cell. So it's interesting that you talked about it. I've not really heard much about it in Nigeria, but I was hearing about it in America a lot.
Okay, so speaking of blood importance now to everybody and to specifically people who have maybe blood diseases, I think I don't know if it's today we are celebrating World Hemophilia Day. I think it's today or sometime
It is.
next week or something like that.
It's today.
Yes. So
No, it's World Hemophilia Day today. It's going on right now.
Okay, so I don't know. I wouldn't know if people in Africa actually suffer from hemophilia. I've never heard before, but we actually, kind of celebrate with them too, since blood disorders. So speaking of sickle cell now needing um, blood and all that, we tend to have a lot of people in the sickle cell community who would rather have who would rather not want to have a blood transfusion, but they will want to do, take so many things. I hear of is it tomato paste and more, something like that, egg, and
And
I don't know how things work, but yes. So I don't know, Dr. Popola, I'm sure you've heard of these things. I don't know what you would say about them. I don't know if they are really healthy, if they really work, or if it's some form of placebo and somehow people think it works. And I don't know, is there some sort of explanation so that we'll know better?
Okay, so first of all, there's no replacement for blood. In the real terms of things, there are things, natural things that are rich in iron that may to fluctuate the blood levels at a very slow, controlled rate. But when it comes to emergencies, when somebody is critically ill, and in this scenario we're talking about sickle cell, know that there are some crises in sickle cell that there's nothing you can do but give the patient blood, help blood. When a patient with sickle cell anemia has, for instance, what we call a hyperhemolytic crisis, and they are passing coke-colored urine, their eyes are becoming deep yellow, what the body is telling us is that they are rapidly breaking down their red cells. When they rapidly break down their red cells, within hours, somebody can lose up to 10% of their already low. And at that point, there's no story about the person needs transfusion. You know, there are times when it's very mild and yeah, it's not really, they can otherwise do activity and maybe just have a drop in the HP by maybe one or less. But if you say, okay, let's wash it, not symptomatic, you can probably deal this with natural, remedies. And these natural remedies do not include malt and tomato paste because all those are things that I don't even know where people get these ideas from. Mix malt and all sorts of whatever. All these things are there's no scientific to say that they build iron level or people should people should demystify it. There's no trick or there's nothing hidden when it comes to health. If you need help and you should get help. And there are times that it's just not person has to have healthy blood placed. So yeah, once the doctor has told you that look, what you need is a blood transfusion. Many times it's an emergency. There's no joking around about it. You just need to get the blood transfusion.
yeah.
Okay.
And speaking of blood, I know that one of the challenges people don't want to go and take blood is this superstitious belief that blood has some issues and there's issues taking blood. So people always like, oh, I rather not take blood because there's this superstitious belief. I even know there's some religions that doesn't even allow you to take blood. So how do we manage this situation. I remember there was one a father, the child was very sick, and the father said, the pastor said they shouldn't take blood, that they should just carry the child home. And I don't even know what happened to the child, but the child, the doctor was telling me the child was very, very, very sick. But these are the challenges we face. So how do we manage such superstitious beliefs in a society like this that we live in? Dr. Boduri, Dr.
Okay, well, first of all, when there is a need for blood, the patients will know that we really need to have blood. The doctors would have told the patients, would have showed them clinical evidence for the need too. So the patients, as Dr. Kola said before, might be breathless, might be weak, and then would have had a blood count done and would have been able to prove with that blood count that the blood is also low. So we need to establish the need for blood for whosoever needs the blood, and then we begin to dispel the what do you call it, the myths around it. We need to be able to tell the patient that if there is no blood, that it could cause the person the one form of mortality or the patient could die. If you do not have blood at the right time, this complication can happen. That complication can happen. That is for people that do not have any form of strict religious beliefs about taking blood. So once you explain, give them, it's like you advocate for it. See, I'm managing you. I need to take care of you. You are in pains. You need to have this blood. We need to be able to explain to the patient the reason why this patient needs blood at that time. Understand? That is just like I was discussing yesterday. That is a place of consent. And just don't just come and you're going to have blood. Of course, somebody that has had a belief against it will tell you, I'm not interested. No, I don't want. But if you begin to tell them the risks about it, yes, there's a risk for taking blood. You might have blood transfusion, but there is more benefits for it than risks. See, if you take it, you will be better. Your lifestyle will be better. You might not even have this particular thing. There are different reasons why you have blood. I'm sure we'll talk about it here. There are different forms of blood transfusion. So we need to be able to explain to the patient that this is why you're having this. Is it because of this particular illness they're having this? Is it because of this? So we need to be able to explain to the patient why, and not just the patient and the patient's relative, why the need for blood is important at that time. When it comes to people with religious beliefs and specifically the Jehovah's Witnesses, for the adults, they have a right to say they don't want blood. They're adults, they understand the implication for this. But also we as healthcare personnel, we should also try to explain to them why they still need to have that blood. If you explain and they still insist that they don't need the blood, then we will let them be. And that is why it's good to have regular clinic visits before the need for blood. I have patients that are Jehovah's Witnesses that they would have told you during clinic, hey doctor, I'm not interested in having blood. So people like that, I would have been looking for alternative means of them making their blood count stable. I'll give them prophylaxis against malaria, make sure they protect themselves against so many things, tell them what to do at all times. When you have crisis, please come as soon as possible. And as people said, there's no replacement for blood. We only try our best to make sure that the blood count does not fall to the extent that blood transfusion is needed. And when blood transfusion is needed, we would explain why you should have it. So for children that are below the age of 18, that is the official age of making decisions, there are courts. If a child needs blood and the parent says no, I have a right to escalate it to the judiciary to make sure that the child has the blood that he or she needs. We cannot just let the patient make that decision and we abide by it. So we have a right. So like in lawsuits, we have a court just around there. So it doesn't take us so much time to call in the judiciary to this. But for adults, if they do not want blood, despite all our persuasion, we have a right to abide through it. And that is the place of consent. I told healthcare personnel yesterday that we should begin to compulsorily take consent before transfusion, consent before the episode, as in there's usually a what do you call it, a prescription for blood. You don't just give blood. Oh, you're going to have 3 units of blood, you're going to have 4 units of blood. Take consent for it. If a patient is going to have extra blood transfusion every 3 months or every 2 months, then take consent for that year. there should be a place for consent. That is where everybody agrees on the form of management. Thank you.
Wow, I'm really impressed that at least I was going to ask, but you already said it that like in lawsuit, but that's because there's a court around the corner. So I'm beginning to wonder for places where there's no court around the corner. I'm trying to. So what would be the case? What would be the case because there's no court around the corner, and you need to
Yes,
one needs to escalate the issue. Do you start
yes, we need to escalate it.
transfusing? Yeah, do
No,
you start
I will not transfuse.
transfusion process? So you
Well, I
wait
won't. I will
till
take blood for well, I will take blood for grouping and cross matching, but I will not start the transfusion process. I will document at each period. Immediately the patient tells my child does not, I'll write the time. The parent says it and document. But I will prepare for transfusion just in case. I won't say because the
yes, but
parent
I'm
said so
asking
and
now
I'm going to escalate it.
I'm asking in case of a minor now where you need to
Yes,
escalate the issue.
I will start
Yes, so
transfusing, but I will
would you
take
still
blood
wait till
for. Well, you know what?
okay.
Personally, I will not transfuse. I will take blood for grouping and cross matching. I will get the blood ready while I escalate.
Okay.
Because if
Okay.
you transfuse, they can take you to court. And that is the place of medical, legal, medical, medical legal issues that we have here. If we take it to court, on the long run, I will win because I'm trying to save the life of that minor. But during that period, I will escalate it, get the judiciary, make calls. There's so many things you can do on the phone. Once I call, I've not really been in a situation like this, I must confess. I've not been. I have
Okay.
had Jehovah Witnesses whose children, initially, I'm not interested in saving, giving this child blood, but no, there's a place for advocacy, there's a place for communication, relationship. You know, the way we treat our patients really matters. The way we do it. I've not had very difficult cases like that, but I've had Jehovah Witnesses that will tell you that no, I am not interested. By the time we tell them the child needs blood because of this, tell them that if you do not agree, I'm going to have to call the court to it. I know, go through that process. The ones I've had, they have agreed to take blood. So I've not had very difficult cases. But peradventure, I meet a difficult parent, I will not readily transfuse until I start the process of getting the court involved. It's just a call away. Everything is just a call away. But I would have taken blood for grouping and cross matching and then prepare the blood just in case they give me the order. So I don't know what Dr. Popola has to say about it. Have you had a difficult case like this before?
Right. So have I've been involved in the team where we have, Jehovah Witnesses, not necessarily in sickle cell, but issues with Jehovah Witness and needing blood transfusion, but refusing. And just like you said, if you communicate patiently with your patients, they don't want to die. When you tell them that this is the only way out, I've had people that would they'll say, okay, you know what, I will take the blood. Let's put a screen so that they will say no, people don't allow that. Nobody will see what's going on. But they'll take the blood. But of course, there are those that, would probably still be difficult. I haven't really had things like that. Sometimes it says, so I've heard of cases, from other colleagues, and yeah, many times it's very unfortunate because be a husband, refusing transport wife or the mother refusing for the child. And sometimes it is straight up. But you have to, when it comes to stuff like that, it has to be fully documented, the legal aspect, legal department of any facility or government has to come in because you're not covered as a doctor. Yes, they're trying to help, but the other person can sue you and say you went against their wish, you know. So yeah, when you talk and they agree, you have consent in the consent form to agree to taking the transfusion. If they don't agree, then they involve legal way.
Wow. It's interesting. I think maybe if it's a public hospital, like a government hospital, it may be a bit easier. But it's when it comes to private hospital, which this example I gave, it might be a bit more challenging, understanding where to who to reach and where to go so that the child can get the adequate respite. But anyway, let's go back to the basics of we're talking about blood. And Dr. Bodri, you were talking about, I think you said the reasons for blood and the basic when blood is necessary. Can you expand on that?
Okay, we have various reasons to take blood. Understand? It might be to correct a low blood level, that is anemia. Understand? And it might be so. We have most sickle cell patients take blood because they are trying to correct the low blood level they have, which can occur during any form of illnesses. So you come to the hospital, there is a bit of crisis, and then you do all sorts. You realize that the patient has low blood level. But we have other reasons why we try to give blood. It depends on the form. So the simple top-up transfusion is the one that happens that there's no blood, there's a low level, and you give. But there are some other reasons why we give blood. It's not actually to prevent that low level, to prevent other forms of diseases, like when somebody has an impending stroke, you want to have an exchange blood transfusion. Hope you understand. So you need to give blood there. If a patient has, okay, I've talked acute chest syndrome, that's another very common reason. We want to give the person blood. Such cases are called exchange blood transfusions. When the person is going to have surgery and the sickle cell index is very high, sometimes we need to remove that blood and put another form there. That's another indication for exchange blood transfusion. And then we have the hypertransfusion form, hypertransfusions or the chronic transfusions, which is usually due to stroke, to prevent another episode of stroke. So there are different reasons why we need blood. It's not just because we want to solely transfuse. It might be because we want to remove some to put a much more healthier one in it. And this is one part I really love Dr. Shadow talk about, because she does quite a number of exchange blood transfusions, the automated forms. It's so easy to do. I need to give you my first experience of exchange blood transfusion and how I became a very strong advocate for it. About 5 years ago, I was seeing a patient and she just kept having this crisis. We kept doing everything. We kept doing everything possible there. And it was one of the very expensive and good hospitals. And just wasn't going away. And after a while, I began to suspect that maybe she had opiate addiction, because we had to start giving her morphines to tell you how bad the pain was. And she even requested her, because she was coming from outside the country, came to Nigeria for a visit, and she came into this. So after about 2 weeks of trying, of which I wasn't called from the beginning, I was called in after about a week of the crisis. So this was like 3 weeks of pain. Imagine if you were going through pain for 3 weeks. So I told her, please, you need to have an exchange. And the friend said, what exchange? We are coming from the UK. We've never had exchange. I said, well, maybe you need to talk to your hematologist in the UK. We have a facility here in Nigeria that can have an automated exchange. At that time, it was just Sickle Cell Foundation that was doing it. And they finally agreed after about 72 hours, because they had read about it, but they just didn't believe that it was possible around here. And I followed them to Sickle Cell Foundation, because that was my first exchange in Nigeria. I wanted to reassure them, so I was there. Do you know what? As the exchange was going on, she was like, the pain is reducing. She had a swollen jaw, so I thought she had an osteomyelitis. that time too, and that was what was also causing the chronic, the persistent crisis. And I could see it. Everything was just, she was like, I'm getting better, I'm getting better. I know after that, I became an advocate for it. That is the magic an exchange will do when you give the right, when it's done at the right time with the right type of blood. Understand? So I don't know if Dr. Shade Popola wants to talk about it now.
It's amazing how you painted that picture, and it just brings back, memories of people that, are otherwise on the brink of death, and it's as if you just brought them back to life. It's always very, touching to see, and it's always very, happy and fulfilled to see this happen, because I tell you, when there's a need, a real indication for a red cell exchange, many times there's nothing else that you can do that would make that patient get, So yes, there are top-up transfusions that are beneficial, but when we have, like Dr. Chukwamaya said, acute chest crisis, the symptoms of low circulation, and we all know that that's where our oxygen is exchanged for carbon dioxide. If you cannot have that exchange go on, that's one of the fastest routes to death. Stroke, very devastating. You can see an 11-year-old child come down with because of a stroke. You can see a 20-year-old man with excruciating pain from ear to ear, or somebody who just has not been able to even breathe any full quality of life because they are always in the hospital because of pain. Things like this, or they have surgery which is supposed to probably help them get better, and they die after because of crises that occur after a surgery. So, quite a number of things that can easily be averted by a red cell exchange. And the beauty of red cell exchange, just like said, because it's automated, it's very easy. Very easy. I remember when I used to sweat trying to manually exchange blood. Just realized that technology is very, very good. You know, in this case, you can take out 80, 90% of single blood within 2 to 3 hours, and everything just changes automatically. There was a patient we had recently who, in fact, she was having two different kinds of crises at the same time. She had an acute chest crisis
Wow.
in which she was already on oxygen. The cardiovascular saturation was already like 80%. Then she started nursing COVID surgery. Her eye stopped seeing clearly. Her PCB dropped from, I think, 24, if it has 26, dropped to maybe 18 within 24 hours. And she was rapidly just going down. Thank God
Yeah.
for the referral. Within the same day, we were able to exchange her rectal, and that immediately after the procedure, he went off oxygen. As in, her
Wow.
oxygen came back to 100% without any, oxygen. He was out of oxygen 2 days after that. Because we also had a pneumonia and all of that, so that's why she had to stay sick. But even I was amazed at the recovery. And so that's one of the beauties of technology, because you're really able to take out culprit, the main culprit. You're really able to get down to the underlying cause of the disease. Most of the other things that we try to do, we are just able to symptoms. But the underlying problem is still there. Sickle cells blocking circulation. So if you can get them out of the way, you realize that with the AA brother, they get better, able to go on
Yeah.
with their life. So it's really something really wonderful for the residents. It has really improved the quality of life for a lot of people. But of course, we know that it comes with a lot of cost, and there's a problem where most people are not insured.
Yeah.
Most health insurers won't
Hmm.
cover for it. So there's a lot of imbalance when it comes to supply versus demand. And we just hope that things get better in terms of people actually getting access to what they need.
Yeah, I agree with you on that on the expense because I too have had EBT, exchange blood transfusion about twice. I know the cost. And then also, I think another thing I found about EBT, which I know I've talked to you, Dr. Popoala, about, is that the experience you go through in even trying to get the EBT done can be a bit traumatic, to especially when it comes to looking for bail.
So
Especially,
I agree with you. So
yes.
yeah, that part, I think it has to do a lot with the processes of the organization that carries the exchange out.
Yes.
So I can say that, oh, as a as a doctor, I can learn how to cite central lines, which I can do. But I will never do it as well as a vascular surgeon.
Yeah.
I'll probably get it on fifth try, try. And the vascular surgeon will only get it once with the right tools.
Mm,
I
yeah.
actually do agree with Dr.
Okay.
Popola
So,
on that. If there's going to be an exchange, then I will not depend on peripheral veins because we are going to be moving in and taking out quite a number of blood. And for
Yes.
someone that has been having recurrent crisis or someone that needs it, most especially that have been ill for a while, most of the vessels would have been tissued with other punctures from maybe other forms of maybe from rehydration or from drugs. So for someone that needs an exchange, my first advice is to have a central line so it goes in easy. And if you need to repeat the exchange anytime soon, you can keep it in situ. Understand? But usually after the main exchange, immediately after that, you really do not need to repeat anyone anytime soon, especially when a large volume has been taken out. Because I know that you could have a 6 unit exchange, 8 unit exchange. I have seen someone that had a 4 unit exchange, and I was wondering, so why did you have a 4 units when you could have just had much more? It depends on what the sickle cell index and what value of what percentage of sickle cell you're trying to achieve after the
yeah.
exchange. So really, I think organization really matters. Then there's some places they won't even give you things to numb the pain. There are all sorts. You can have
Because
spray,
mine was
lignocaine
femoral.
spray,
Yeah,
femoral. Hey, have
mine was
yes.
femoral.
So we should have just called a specialist to do it. No, people that go for dialysis understand they might not be surgeons, but they're anesthetic nurses that have been trained. They have been someone that's comfortable with having a femoral line in. Hope you understand. So facilities that are having exchange transfusion should have things to make the person having that procedure comfortable. Lignocaine sprays are there, lignocaine patches are there, and when you're comfortable, you really might not feel so much pain on the long run. It's like you're having an injection. Some people say in Yoruba, let me say, oh, well, not the some people when they give injection, it's more painful than others. But personally, I think it's just your, it's just the skill, how good you are, and how well you make the patient comfortable and relaxed. Understand? If I'm relaxed, I won't feel the pain. If I'm tensed up, no matter how good you are, I'll feel some pain. So as I agree, it's all about the organizational, what do you call the processes there, and what you put into place to make the patient comfortable. I'm so sorry about your experience.
Well, I've had all sorts of stories. Unfortunately, I had a bad one, and then some months later, somebody too went there, but her own was not lucky. She immediately after the blood transfusion, she gave up. So,
Okay.
and that's why I ask these questions, because sometimes we don't discuss these issues enough to maybe to understand, okay, what should we look out for when we are going to continue to do blood transfusion? How many blood should we take? Do we all take it at once? Those sort of things, so that we have a voice ourselves to be able to say, no, this is the wrong way you are doing it.
Mm. Yeah.
So
Okay. So speaking about complications that blood transfusion to help, I've heard that blood transfusion help chronic leg ulcers, but I wouldn't know how true that is. Recently, one of our beneficiaries had he came up to us to say he was going to get some money and he was going to have an EBT done. He has had chronic leg ulcer for over 20 years. So I don't know how true, we don't know how true that is. Can it help? Is it something
Okay.
that can give people with chronic leg ulcers a little bit of hope, at least, apart from
Okay.
skin grafting? We find that skin
Yeah.
grafting, there's always a problem with it. It's always breaking down.
Okay.
So, yes, please go ahead.
I've had a lot of off the counter treatments for chronic leg ulcer. Um, with respect to blood transfusion or exchange blood transfusion, I don't think chronic leg ulcer is top on the list, but people have tried it with it. It's not top on the list on the Nigerian, there's this national guideline for what do you call it? For management of patients with sickle cell disease. So chronic leg ulcers are not there, but from practice, I trained under two very astute, very wonderful guys, men, sorry, Professor Dosunu now, Professor Komu at two different facilities. And I know that when we have very bad chronic leg ulcers, sometimes you want to maintain the blood at a particular level. So based on the pathophysiology, I know that Dr. Kola will have a lot to say about this. So if there is more blood, why do we have chronic leg ulcer? We have different reasons. We have talked about inflammatory bodies. We've talked about low levels of blood at that area because their extremities, blood is not flowing very well. We've talked to some people have explained the pressure around that area. And there have been a lot of explanations. But with respect to blood, it is believed that when the blood is a little bit higher, there's more oxygen transported to that place, and oxygen helps tissues to heal up faster. Understand? So, but exchange blood transfusion and chronic leg ulcer, I've not seen it as top of the list. It's like off the counter, like every other treatment people do. But simple top up transfusion to maintain the blood count at a particular level, maybe 24, 26%, or understand, could help the ulcer to heal faster. So, what do you have about exchange blood transfusion and chronic leg ulcer?
Right. So, in my experience, I've actually seen that it has really helped those with chronic leg ulcers or chronic ulcers in general. So, yeah, just like you said, it's not one of the indications within the books, but I've seen some 3 to 5 patients who have either had recent ulcers or chronic ulcers or recurrent ulcers who, after getting the red cell exchange, once they keep up with their wound dressing as well, proper wound dressing, it tends to heal much faster and it stays healed instead of breaking down. But of course, because we know that within 4 months, the sickle cells are back. If
That's
there is another risk factor for the ulcer to break down, it can break down again. So that's the issue with it.
Mm.
It's because leg ulcers tend to be chronic. And the red cell exchange is a temporary measure. It's not something that will totally take away the ulcer because they may go in and out, in and out, you know. So the patient also has to be very careful in how they take care of themselves and how they try to prevent ulcers. So I think that's very important as well.
Hmm. The saga of leg
Okay,
ulcer.
so I have a question for Dr. Shikomani. There's always I don't know, there's this superstition,
My
or
daughter
I
is
don't know
running in
how
and out of
I
the
think
room.
it's difficult for people to donate blood. That's one question. I don't know
Please
how
ask
we need
again.
to
Can you
tackle this.
repeat yourself? Can you repeat yourself?
Yes, I said okay. I said one is there's a huge problem with people donating blood. It's always a problem getting people to donate blood. I think a lot of people have certain misconceptions or myths about blood. One is how do we tackle that issue? Then two, since you work with the Lagos State Transfusion Blood Service, how is it sometimes we find it a bit difficult getting access to blood for people who need it. So how do we? Is there a way to get to this, fast enough for people who need it, instead of always having to we need these, we have to sort of
So, first of all, I
WhatsApp messages and things like that. So
yeah. First of all, I must tell you that there is severe scarcity of blood in Lagos State and the whole of Nigeria. It's not just happening here in Lagos State; it's the whole of Nigeria. We really do not have blood. Um, let's start from the basics. I like to explain from WHO. WHO has advised that we need at least 1 to 2% of the population of a community for the blood to meet the blood needs of that community. So if you look at Lagos, the last census about projected census about 8 years ago said Lagos State about 22 million in population. The population is about 22 million. As at 2020, one of these international bodies said Lagos population is about 226 million. So I like to use 26 million, but I know that we are highly populated in Lagos. Nobody really knows the exact amount. So let's use 26 million. And so 26 million means that we need about 260, at least 260,000 units of blood. If you look at 1% of that, of 26 million, at the Lagos State Blood Transfusion Service, we collect an average of 90,000 units of blood per year. I have not added units of blood from federal institutions like LUTS, from institutions like Federal Medical Center, Ibutemeta, from Orthopedic Hospital, Igobi, from the military hospitals, from the police hospitals. But generally, I do not believe that all the units of blood they collect there will be more than 90,000 that we collect here in Lagos Blood Transfusion Service. So you can see that there is severe scarcity, and almost every time there's an acute shortage. It is much more disheartening to know that only 10% of this blood is gotten from voluntary blood donors. I know that if we continue to, most of this blood is gotten from commercial donors. So the
Hmm.
first thing to do is to make sure that everybody becomes voluntary donors. We have our voluntary donors that they give us blood at least twice a year. I don't need to think about looking for a donor outside. I don't need to think about somebody replacing blood once we have those voluntary donors there. So the first thing you and I need to do is to encourage everybody to be voluntary donors. Advocacy is quite tough. There are lots of myths about blood donation. Everybody is scared, coupled with the economy. They're like, oh, have I eaten enough? You want me to donate blood? I don't even have a good job. You want me to donate blood? Look at me. People think that being slim is proportional with your donation. I know a lot of slim people that have donated like 40 times already. So there's a gap in that advocacy, I must confess, and we are doing our best. We cannot do it all alone at the transfusion service. It is you and I. I'm happy that I'm wearing this t-shirt. This t-shirt says each one reach 10. We had to start a voluntary donation campaign this year because we realized that, sorry, can you see? So
Yeah.
it's each one reach 10, it's a
yes,
voluntary blood donation campaign, because we realized that the whole of the Lagos State Blood Transfusion Service cannot single-handedly advocate or increase the awareness for the whole of Lagos. So we started this campaign this year that each donor, each voluntary donor, each person that believes in voluntary donation should reach out to 10 more people to donate blood. So it's like this blockchain that everybody does. It's like a blockchain, one person, 10. And we even had to put some incentives to encourage people, because voluntary donation, we really cannot give financial remuneration, because it converts it to what commercial blood donation, which we actually are against. Understand? So it's you and I. If the community of people with blood disorders go out there and tell everybody, see, we need blood in our community. If LB hemophilia, you were talking about hemophilia. I was on television yesterday and I was with one hemophiliac yesterday. We had a webinar and we had about 10 hemophiliacs on our webinar whereby two talked. We have 600 plus registered hemophiliacs in Nigeria. Hemophilia is real amongst us in Nigeria. If you so it is real, it happens. They have been having what do you call it, support from the World Hemophilia Federation, and we are really grateful to them for what they are doing, because we try to avoid blood transfusions as the blood-based factor replacement for them. So that aside, so if everybody with blood disorders, if everybody that needs blood, if every chronic renal failure that needs recurrent blood transfusion, if every oncology person that needs recurrent blood transfusion goes out there and tells everybody, please, I will be saved, I will live longer by the blood you donate, then we will be able to become advocates of voluntary blood donation, and the number of voluntary blood donors will increase. So it all boils down to you and I once again.
Yeah, you actually just schooled us now. Thank you very much. Paula, there's a question on the screen. I don't know if you can take that before we round up. So one of our viewers is asking. Yes.
Taking blood. It's advantage.
Hello.
Yeah, where are you?
Hello, can you?
Are you here?
So is that for Dr. Popola? She's there, she?
Yes. Okay, yes.
Yes.
Okay.
So can we also know the disadvantages of taking blood? Is that the question?
Yes.
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 It's a very valid, very good question, because of course in life there's always pros and cons to everything. Now, in regards to taking blood, disadvantages can occur when processes that are supposed to be followed are not followed properly. Otherwise, blood transfusion should be a safe process. So what do I mean? Everybody has a blood group. We try as much as possible to that the person is when transfusing. Even with this, you have to cross-match. So there are processes the donor and the patient's blood to make sure that there is no reaction, because reactions can still occur. Patients can have different types of antibodies that will still react even when it's the same blood group. So that should never be compromised. That should never be skipped. These tests properly. So of course, these are questions that patients should also ask their doctors. Please, has this been properly cross-matched? There was no reaction. Let's be comfortable. Second is, of course, to check for transfusion transmissible infections. Blood is the medium by which viruses, bacteria, all sorts of organisms thrive. And you don't want to get transfused with blood that's been infected. Why we have to give kudos to the Lagos State Blood Transfusion Services, which Dr. Oshikomaya has done such a great job of, because they tend to have to always ensure that all blood that is collected from any donor in Lagos State is screened by Lagos State. and it's screened not by a rapid test, but by a confirmation test called ELISA. That will let us know for sure whether any of these viruses are
Yeah.
present or not. And if it's detected, that blood cannot be given, it has to be discarded. So that means that any patient as well has to also ask to see the stamp of the Lagos State on any blood product that they will be taking. Because that then makes you doubly sure that at least HIV, hepatitis B and C, syphilis are screened for, which are the ones that we need to do something forward. And of course, during the transfusion, then you also want to make sure that it's given by competent individuals, competent nurses. The transfusion order is very simple. You're not just going to run it open like a tap and go and sleep. There are things to watch out for. There are transfusion reactions that can occur even when they say there's no reaction. You have to watch. There's fever, comes up, there's an acute transfusion reaction that can occur at any time. So you are monitoring vital signs, you're monitoring patients, you're seeing going and smiling throughout the 2 to 3 to 4 hours that the patient might have to take it. You can't also give blood for 4 hours because by the time after that, then starts producing infections. It can easily grow infection. So all these things, it's not and you can't have a tissue line, for instance, and then you say, you're waiting for the doctor to come and sight the line. Blood is still outside for 2 hours, and you want to continue giving it. All these things are the things that will make blood. But that's why it's important for each sickle cell warrior to have a hematologist. Because the fact of the matter is that if that is your specialty, you have a better idea as to how to handle it. So these are things that, because there are people that would have had fatal reactions to blood transfusion simply
same
because
here.
they were not done right.
Yes.
So
Yeah, I agree with you that I had one towards the end of I think the lady decided to rush it as and my blood pressure, I could not breathe. They had to give me emergency billion. So I can imagine what will happen. But thank you so much. It's been an interesting, it's a wide topic really, and there's so much to learn
Yeah.
about the blood, so much advocacy and policy that are needed to create awareness of blood, especially in terms of blood donation, because I know the challenges we really face
Yes.
in Nigeria, getting more and more blood donation for our warriors. And I believe that when we, as you said, Dr. Oshikobai, when we collaborate, when we do things together, we're able to create the awareness a bit more and more, and
Yeah.
hopefully to make a difference in the lives of not only just people with sickle cell, but people who need blood generally. Thank you so much. So I'll hand you over to my wonderful partner, colleague, Maureen. And thank you so much for joining us.
Yes. Thank you very much. At least there is something in my head. There are 3 types of white cells. I'll come for lecture, Dr. Paula. One day I'll come for. I mean, that one just blew my head off. I was like, 3 types of white cells. Wow. So,
no, there are not 3 types of white cells. You didn't even hear me very well. I said there are different kinds of
three
protective white cells.
different.
There are more than 3. There are more than
They're
3.
more than three. Okay now.
Oh, oh my God. Okay, so I really need to get this lecture. And so, now we need to get this lecture one day. As
Yes,
in
so
one,
we have
yes.
to get it.
I'll send you
We
my
have
We
to
account.
learn
get
I'll send you
it.
my account details.
no problem. No problem. Okay, so thank you. It's been nice having you, Dr. Shikomaya. Thank you so much for honoring us. Thank you for honoring us. Whenever we call, you always answer. Thank you. We cannot thank you enough. Thank you very much.
Thank
We
you very,
really
very much.
appreciate And I don't know, we hope to have you back again. We can't just let you go. There's so much there that, people need to know about so many things.
Yeah.
And I have really learned a lot. And I know our viewers have, learned so much from this. We have to go now. Tomorrow is Sunday, and I wish you a very good weekend once again. Thank you so
Okay.
much.
Thank you too. God bless you, everybody.
Hey.
God
So thank
bless
you,
you.
everybody. Join
And
us next.
so, till we come your way again next week, yes, same time, same place. This has been a production of Sickle Cell Advocacy and Management Initiative. Don't forget to follow us across all our social media handles and subscribe to our YouTube channel, please, at Sammy Update TV. Thank you and see you next week.
Yes, and like our videos. Like our videos. Thank you.